I'm going to show you how to feed your baby in a bottle carrier. So this will apply for breastfeeding and bottle feeding. So I'm going to look at different types of carrier and I'm going to show you different techniques and different positions. Whatever your baby prefers in terms of feeding, what the latch is like, what kind of position you prefer, you might have to adapt and you might have to try different things until you find the position that works for you. Also, as your baby grows, you might find that you can achieve different position depending on the head support and the head control. So try lots of different things. Okay, so first we're going to start with buckle carriers that don't cross straps. So for example here I have a Tula Explore. I'm just going to remove the hood so that it doesn't get in the way. So I have a Tula Explore and these have straps that are sewn to the panel, which means that I can't unclip it or I can't cross them. So it's only straight or rucksack style straps. So I'm going to put it on. I'm going to put my waist belt on. Like this. So you don't need to make adjustments, you just put it on like you had it before. Roughly around my waist. If you want, you can bring lower down, depending on if you are breastfeeding and the size of your breast, you might want to bring it lower down. And I'm going to bring my baby in the carrier upright. So I'm just moving the headrest here so I can have more visibility, especially with small babies. You want the headrest to be down if possible so you can see your baby better. So I'm just going to have my baby in the carrier like this. Bring my baby in. Plates through the holes. Okay, and have my baby in the carrier. Suddenly they want to feed. Okay, so let's get ready. So if I am bottle feeding, what I'm going to do is I'm going to loosen on each side and I'm going to loosen my waist belt a little bit as well to just lower baby down like that so I can see baby's face. And also I don't want to have too much pressure on a baby's stomach when they're feeding. And then I can just feed like this using a bottle. I can bring my baby more to this side if I want to. I can even remove a strap. Keep your chest strap clipped in so I can see my baby better. You could even do a seated sideways carry. So you're going to bring the legs like this. Sit your baby on the side. Make sure you support the head the whole time and then you can feed. Okay. So when you breastfeed or bottle feed, make sure the head and the spine are always aligned. If I want to breastfeed, I might have to loosen my straps a bit more. So I'm just going to keep going until I can reach breast height and then I just latch my baby on. Make sure you always support the back of the neck, okay? Leave the head free, so let the head move forward so your baby can unlatch, and make sure you're monitoring your baby the whole time. Make sure you can see the nose. Bring hands to the breast when you're breastfeeding and make sure again that the head and the spine are always aligned, okay? All the way down. So you can feed like this, support, keep monitoring your baby, but you can be one hand free. If your baby doesn't like to feed upright or it doesn't work with the size of your breast or the latch, it's fine. We can try to do it cradle style. So cross cradle. I'm going to take baby out. And then I'm going to loosen my strap on this side. You can unclip. And then we're going to bring it across the body like that. And then use the panel to give myself a little bit of support. So I'm going to bring my baby into the carrier. Make sure the panel covers all the way to the knees. This strap you don't need, you can just tuck it in. Just make sure you're not tripping on any of the webbing. So I'm just going to tuck it in there like this. And then once I've got a good position, I'm going to grab my strap and I'm going to pull forward a bit to give me some support. So again, it's not hands-free, especially not if you're feeding cradle style. So if you're breastfeeding, again, you're going to bring baby to the breast, hands to the breast so they can cup away. And you still need to support, okay? So you support with one hand, with your elbow. Make sure again the head is free and is not pushed forward. Panel should cover maximum all the way to the neck. but don't use it to support the head. It is your job to support your baby's head. And then you can cover all the way to the feet like that. And then you can feed. You can use that for bottle feeding as well. You can sit up your baby maybe a bit more, like this. And again, you support the head the whole time. Once you're done, you just go back and then you just put your baby straight back in. Before you retighten anything, always burp your baby and then retighten your straps, because after you feed, babies usually don't really like a lot of pressure on their stomach. It can make them feel a bit uncomfortable. Okay, so that's for a carrier that doesn't cross strap. So quite a few are there. Mostly all the Tulas are like this, but there are other brands as well that can't be unclipped. If you have a carrier where you can unclip the straps, so all the ergos, you can do that. So this is an ergo adapt. I can unclip the straps, which means I can do cross straps. Same with the Becco. All the Beccos, all the Bobas, you can unclip. Ease Me as well, it's really great. Breastfeeding, you can unclip and cross straps. The Zensling or the Integras, so many. I'm going to demo with the Zensling because I really like breastfeeding with these ones. Okay, so I'm going to put it on. And I'm just going to put my baby in the carrier and cross the straps. So I'm just going to have my baby there. Bring the panel across, and then you're going to cross your straps, hold baby, and clip, and tighten, and then same here, pull down and tighten. Okay, so some carriers have what we call dual adjust system on the straps, which means that you can pull forward and you can pull back. When you have this system, so you have it on the Zens, on the Integra, on the Boba X, on the Beccos as well, super handy because you can choose how you pull. But for feeding, you can just loosen this part and then keep going until your baby's low enough for either bottle feeding, or keep going until your baby's low enough for breastfeeding. Again, you can loosen the waist part. So keep going until you reach breast height, or you reach a height that works for you for bottle feeding. Same thing for bottle feeding as with the other carrier. We can just do a cradle sideways seated like this. So you bring the legs through and arms here like this. And then you can feed baby. Again, you always support the head. So if we want to go to the hip for breastfeeding, we can do that when our straps are crossed. So you're gonna loosen and then bring the baby to the hip, and then you're gonna bring this strap around, support baby, retighten, make sure baby's well supported. You can retighten the other straps if you need to. So retighten both sides. Again, not too tight. Make sure your baby can breathe fine and digest the food fine. I'm going to do exactly the same thing. Hands to the breast. Make sure the head and spine are aligned when you feed. Support the back of the neck and the top of the back as well, but not the head. Don't push the head forward. Always monitor baby, but you can be one hand free, okay? It's very important to remember when you breastfeed and you bottle feed in Slings that even though it feels like you can be hands-free and you can just play with your toddler or other children, it's very important to remember that you can't ignore your baby. You need to really make sure the nose is always clear and your baby's feeding well, and just keep an eye on your baby, okay? It's very, very important. Okay, so that is hip carry. Now, if I want to feed cradle style, if I don't want to feed upright, I can absolutely do that as well. So I'm gonna, either you can just take this off or you can take your baby out completely. But I'm gonna loosen everything and I'm gonna bring my baby. So you can take your baby out or you can just go straight like that. I'm going to a cross cradle. This strap, you can leave it clipped in, you can unclip, it doesn't matter, we're not really going to use it. Just make sure it's not dangling on the floor, it's very important, so you don't end up tripping. So here, what I want to try to achieve is I want to cover from the knee pit all the way to roughly where the neck is. and I'm going to bring hands to the breast. I'm going to retighten a tiny bit here, and I'm going to support here. So you can cross cradle or just support with one hand or with your elbow, but make sure you monitor your baby again. Nose clear, and my baby is in full view. It's very important to remember that your baby needs to be in full view, okay? So you don't want a strap that's covering, so that's why we remove the other strap, otherwise it'll be covering the face. You need to be able to always see your baby. But this gives you a lot of relief. With the Zensling, you can even do that. It's really nice and comfortable, and then you can feed. And you've got one hand free. Awesome. Okay, you can do that for bottle feeding. Again, same. You can bring your baby a little bit higher up, arms in like this, and then you can feed. Support the neck as usual. You could even try a rugby hold, so that would even involve quite a bit of loosening, but you can just keep going like this, and then yes, you can rugby hold. If you prefer feeding like this, that's totally fine. You can play around with the straps. If you find this is not working, you can bring it around like this, so it's not like so much in the way, and then you just retighten here. So the most of the weighting will be to the front. As long as nothing's covering the face, then you're good to go. So yeah, you can even rugby hold and feed. It's amazing. You can do everything. Okay, now I'm done. I'm just going to unclip because it's just a bit quicker. I'm going to burp my baby, and I'm going to put my baby straight back in the sling. So as you can see, lots of different techniques. It's worth exploring, seeing what works for you. Take your time. It does take a little bit of practice feeding in a sling, especially if you have a newborn, if you're not used to breastfeeding. Really just take it slow, try different techniques, talk to a sling consultant. We're really happy to help you. Being able to feed in slings is really quite amazing. It's really quite freeing in a sense, because you feel like, oh, I need to find a seat somewhere, a bench, so I can feed. No, you can do it. You can do it standing up. I will say always try to sit down if you can, because it's nice anyway. Take it easy. You can use it at home, even just to give you a little bit of relief on your shoulders. Take it slow, relax, shoulders back, give yourself a little shake like this after you fed, so you're shaking off any pressure and any aches and pains away. And keep going as long as you can. It's amazing. Thank you very much for watching.